Before you start taking Xarelto, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. Your doctor may also recommend taking a low-dose aspirin once a day. If you have trouble swallowing whole tablets, you can crush the tablet and mix it with applesauce, but be sure to eat the entire mixture right away. If you need to give this medication through a tube into the stomach, ask your healthcare professional for detailed instructions on how to properly mix and administer it. Remember to take Xarelto at the same times each day to get the most benefit from it. Make sure not to increase your dose or take this drug more often or for longer than prescribed by your doctor. If you experience easy bruising or minor bleeding, such as nosebleeds or bleeding from cuts, it's important to notify your doctor or pharmacist. This medication has been prescribed to you because the benefit outweighs the risk of side effects for you. While many people using this medication do not experience serious side effects, it's important to be aware that it can cause serious bleeding if it affects your blood clotting proteins too much. Be sure to seek medical attention if you experience signs of serious bleeding, such as nosebleeds that don't stop, unusual tiredness, or prolonged bleeding from cuts or gums. In the event of very serious bleeding, such as vision changes or weakness on one side of the body, seek medical help immediately. It's also important to watch for signs of a serious allergic reaction, such as rash, swelling, or trouble breathing. If you notice any other effects, be sure to contact your doctor or pharmacist. Before starting Xarelto, it's important to let your doctor know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. Be sure to discuss any allergies with your pharmacist. It's also important to inform your doctor about your medical history before using Xarelto, especially if you have a history of cancer, liver or kidney disease, bleeding problems, stroke, blood disorders, frequent falls or injuries, or certain eye or clotting disorders. Additionally, if you have any upcoming surgeries or medical procedures, be sure to let your doctor know that you are taking Xarelto. It's essential to be cautious with alcohol consumption while taking Xarelto, as it can increase the risk of stomach bleeding. Limiting alcoholic beverages and consulting with your doctor or pharmacist about safe alcohol consumption is recommended. Xarelto can also increase the risk of heavy bleeding, so it's important to take precautions to avoid injury. Using caution with sharp objects and avoiding activities that may result in injury are advised. If you do get injured, especially if you hit your head, it's crucial to contact your doctor right away. Older adults may be more susceptible to the side effects of Xarelto, particularly bleeding, so it's essential to be cautious when using this medication. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using Xarelto with your doctor before continuing with this medication. It's important to be aware of potential drug interactions when taking Xarelto, as they can change how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xarelto include mifepristone, other drugs that can cause bleeding/bruising, certain antidepressants, and other medications that can affect the removal of rivaroxaban from your body, which may affect how Xarelto works. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that may increase your risk for bleeding if taken together with Xarelto. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. Ask your doctor or pharmacist for more details. If someone has taken too much Xarelto and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include bloody or black stools, pink or dark urine, and unusual or prolonged bleeding. It's important not to share Xarelto with others. Your doctor may also need to do some lab or medical tests while you are taking this medication, such as hematocrit/hemoglobin or red blood cell count. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, just skip that dose and take the next one at your regular time. Don't take 2 doses at once to make up for the missed one. When it comes to storing Xarelto tablet antithrombin agents, it's important to keep them at room temperature away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. If you need to crush a tablet, make sure to use or discard the mixture within 4 hours. And when it's time to dispose of the medication, do not flush it down the toilet or pour it into a drain unless instructed. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.